So my name is Michael Miller. I'm the Chief Mission Officer here at St. Joseph Mercy, Ann Arbor, and I get to say a few words of welcome to everyone here tonight. So welcome to St. Joseph Mercy, Ann Arbor. I should note, while this is the name of the organization, St. Joseph Mercy, Ann Arbor, we are firmly located in Ypsilanti, Michigan. And we are in actually the district of the Ypsilanti District Library here in Superior Township. So that is partly what brought us together tonight. Not long ago, I met Jillian at a different community event, and she brought up this idea of hosting this event, and I could not be more excited for this evening tonight. I've been looking forward to it ever since Jillian first mentioned it to me. Here at St. Joe's, our mission is to be a compassionate, transforming, healing presence in our community. And I think that every time that we can take a step back and consider a new perspective on our relationships with the patients that we serve, with the community that we serve, and with each other as members of a care team here at St. Joe's, we're more empowered to live out our mission more effectively. So I'm really excited about graphic medicine in this presentation tonight, allowing us a new perspective on the healing ministry that we have here at St. Joe's. So now I'd like to invite Jillian up here to officially welcome our presenters.
Thanks, Michael. Yeah, I'm also very excited that we got to partner with St. Joe's on this project. They are in the Ypsilanti District Library district, so if any of you folks are St. Joe's employees, you can actually get a library card at the Ypsilanti District Library, even if you don't live in the district. If you work here, you can get a card and have access to this collection. So we're very excited to have MK here tonight and to have this graphic medicine kickoff, really. This is the beginning, and it is introducing our new graphic medicine collection. So you'll see out in the lobby, we've got quite a few of the graphic novels that we've actually been able to purchase as a library and bring in. I really want to thank Susan Brown and Ben Miller, who are our librarians who are here tonight. Both of them have buy our graphic novels for the library and have already been bringing in lots of memoirs, and so it's just fantastic to have them and their expertise to be able to sort of flesh out this collection and really bring a whole lot of interesting things to the library. And finally, I should say that this entire event and the collection and a whole ton more, 80 titles or something that came into the library came from the Will and Ann Eisner Family Foundation. The Ypsilanti Library was a recipient of a Will Eisner graphic novel grant, and so that helped fund the entire program. So we're very excited about that. Welcome, MK Zerway. MK is here and giving a presentation in Ann Arbor tomorrow. She comes to us, and we found her through a group called Graphic Medicine, which is a collaboration between the US and the UK, who have been talking about this idea of using graphic novels as in medical treatment and recovery to help doctors and patients connect kind of with the emotional side of illness. And so we were so happy to find out that she was in Chicago, that she was going to be in Ann Arbor, and that we could kind of steal her for an evening. MK, interestingly, is the closest you could ever get to being a graphic medicine professional.
That's right. And still it makes no money.
Yeah, true. So in addition to drawing comics and doing the blog Comic Nurse, she teaches in the medical school at Northwestern and in the creative writing department at Columbia College in Chicago. And so she's going to be giving a presentation, and at the end we'll have a few minutes for questions. So thank you so much for being here, MK, and we're excited to hear what you're going to say.
Thank you all for coming out tonight. I really appreciate it. So I thought, since we love comics, we should start with a comic. So we'll start with a comic that tells you kind of how I got to where I am today. But just to start, so as a summary statement, I forgot we had this slide, that I'm a nurse who uses comics to help me contemplate the complexities of illness and caregiving. That's sort of my elevator speech, because you can imagine what I see on the faces of people when I tell them I'm a nurse who does comics. So here's the comic. So when I was a kid, Amelia Bedelia was my favorite book. Do you remember Amelia Bedelia? Right. She's a maid, and she does literally everything her boss says, and she gets in trouble. But everyone loves her anyway. So for example, Amelia is told to dress the chicken, and she does. Whoops. I copied Amelia when my mom said draw the drapes, and Mom never thought that was very funny. And when a patient is admitted to the hospital, the orders always call for the nurse to draw blood. The doctors never thought that was very funny. In nursing school, pathogens made sense to me as characters. And I always explain things to my patients this way. The tests show a bug in your blood, but the medicines can kill it. And it usually works. I'm telling you, Harold, she said bugs in my blood. She said bigger than atoms, but smaller than mosquitoes. I want to transfer out of here tonight. I guess what I'm saying is I was kind of destined for this comics and medicine thing. I'm Comic Nurse. So I've been making comics under this pseudonym Comic Nurse just because my last name, if you've seen it, is awfully hard to look at. It's Czerwiec in Polish, but Czerwiec in English. C-Z-E-R-W-I-E-C. Doesn't roll off the tongue. So I thought, I need a good moniker, so I came up with Comic Nurse. And so I want to show you another comic that's a little more serious story. And it tells you, so I had been making these goofy characters and doing these silly doodles as a way to study and think and process information. But I didn't actually make a comic, which means putting a structure to it, combining a small amount of image and word. Until one day, it was towards the end of the time I was working at an inpatient dedicated AIDS care unit, which is what I did professionally, was AIDS care and hospice nursing. And which unfortunately at one time were almost the same thing, early in the pandemic. And so I had had a patient who I'd known for several years and cared about very, very much had died the night before. I worked the 3 to 11 evening shift. And I had to work the next day. And my patients, who I was going to be starting to take care of that next day, they deserved me to be present to them. But I was still really, really upset about this person I'd lost the day before. And it's something we don't talk very much about in healthcare, is the fact that we experience a great deal of loss, and we bear witness to very moving stories. And they don't tell us in nursing school or in medical school what to do with all that. You're just supposed to just sort of be like a shark and just don't stop moving and it won't catch up with you. But it was catching up with me that day. And I had been writing, trying to deal with all the struggles and the difficulties of being a nurse during the AIDS crisis, and I had been drawing. But one day I was just at a loss, and I had to, by 3 o'clock that day, be ready for work. So, not knowing what else to do, I had a blank piece of paper in front of me. I just drew this picture of myself. And this isn't actually that picture, it's just a recreation of it that I've done for demonstration purposes. And then, not knowing what else to do, and really, as I said, being at a complete loss, I just wrote a few words. And then because they were there, I just put a box around it. And this sounds like an unlikely story, but I swear to you, this is how I started making comics in 2000. And then I just put another box next to it. And I remembered Linda Berry, if anyone's familiar with Linda Berry. She was an underground cartoonist, and she used to have a comic called Ernie Poop's Comic that I used to read when I was in college. And I remember that comic was about really serious things like a dysfunctional family, an abusive father, and difficulties in the family. And I thought, well, this looks like it might be turning into a comic, and serious stuff can be in comics, so I'm going to just keep going with this. What I didn't know in this moment, which is really interesting, is that the empty space between 2 panels in a comic is called the gutter space. And for me, what the gutter space does is it takes this static thing, this static place I was in, and it makes it has to go somewhere. It makes me move on. And so the medium itself was really powerful to me here. So I just kept going. I wrote a few words, I drew a few pictures, and I kept going. And rather than walk you through the whole 9 panels of this comic, I want to take us out to the abstract and show you what this did for me that day. So this was the 9-panel grid I ended up with. And I started in this state. And as I worked my way with a little bit of text and a little bit of image through 9 panels, much to my amazement, I found myself here. And for me, it worked. And I was able to go to work that day, and I was able to be present because I found a place, a home for what I was struggling with. And so I kept doing it. So I kept making comics about experiences I had with patients. So these are 2 examples, and I expect you to read them. But basically what was going on in these comics I was doing was I was starting to integrate what was happening at work and what was happening at home, that I, felt like my jeans were too tight, and, like I was feeling ungrateful in my life, and then I think about a patient. And I was integrating, again, something we as healthcare providers, we have a hard time figuring out how to integrate all these things that happen in hospitals that we bear witness to and then make sense of our lives, outside of work. So I kept doing this. The age unit I worked on closed, and I was really at this turning point of what's going to be next in my career. And I decided that I had a choice. I could either actually learn how to draw, or I could learn how to inform the comics I was making. I wanted to make them better, so either I could draw better, or I could try to inform them with this field I heard of called the medical humanities. And basically, the medical humanities take each of the humanities and the disciplinary approaches and apply them to looking at the practice of medicine. And I went into this degree saying, oh no, I'm going to be a serious scholar of the medical humanities. And I kind of tried to keep it on the kind of on the quiet that I was a comics artist. But luckily I landed in the right place where they, at Northwestern, they got it even better than I did. And they forced me to sort of try to bring it to the forefront. And one thing happened during that educational process that, again, we're going to come back to a comic. So I'm in Chicago, and I'm going to school here. And I'm at the Museum of Contemporary Art, and I see this book, Mom's Cancer. And I think, is that a central line catheter dressing on that woman's neck on the cover of a graphic novel? What is this? Now, that was an image that I was very familiar with professionally, but certainly one that I'd never seen on the cover of the book, and definitely not on a graphic novel, comic book. And so finding that book really changed my perspective as I wrapped up my degree. I went home and I read it, and I said, this Feast guy is a genius. Look at the insightful critique he's making about the healthcare team. Look at how he breaks down what it's like to be a patient. Genius. Are there more like this out there? So here's me on Amazon.com. Cancer made me a shallower person. Cancer vixen, black hole, epileptic, blue pills, Lisa's story. What? And most of those books are out on the table outside. And then I asked at the end of that panel, has anyone cataloged all these? And then that's when I found graphicmedicine.org. Ooh, a doctor in Wales named Ian has. Cool. I'm going to email him and tell him, say how awesome his site is. So this is Ian Williams. He's also a comic artist who's a doctor, and now he and I co-run this website. We've organized several international conferences on comics and medicine. And he coined this term to refer to the interface between the medium of comics and the discourse of medicine. And I'll go more into picking that apart in a minute. He recently published his own graphic novel called The Bad Doctor, which was published by Myriad Editions in the UK and will be released from Penn State Press next year here. So this is the front page of graphicmedicine.org, which, as I said, we now co-run. We took his original site and we reorganized it and made it fully searchable. So if you have a clinical interest area, a disease, a disorder, a question, you can actually go to that search bar right there and put it in and say, you're interested in kidney failure. Are there any comments about kidney failure? Well, actually there are. And you'd be amazed how much is out there in this area. Not just kidney failure, but just the diagnosis range, and there's more being made every day. And we can barely keep up trying to keep the website current. Let's take a step back and do some terms. First of all, I like to think of comics as sequential art that conveys a narrative and often incorporates text. So you've got image, image, image. And the implication between those images is a passage of time. And there's some really interesting work going on in neurology at Tufts, I believe it is, where someone is looking at how our brains assemble narrative based on images. It's fascinating. It's a grammar that's not actually analogous to the kind of grammar we use in text. It's fascinating research going on. I want to make the point that, and I think you are sophisticated readership, so I don't have to stress this, but comics are an expressive medium containing many genres. So if you were to think of, so by example, if you were to think of film as only Disney movies, that'd be like thinking of comics as just for children, right? It's a medium. It's very powerful. So graphic novels are basically long comic books, right? Art Spiegelman, I think, said graphic novel is a comic book with a book with a spine and a bookmark that wants to be reread, something like that. Even though he originally fought that term. So graphic novels, that's it. So graphic novels are long comic books with a spine that want to be reread. But when people ask me what I do, I say I make comics. And of course, he did Mouse, one of the most. You have it on the table out there. It's one of the books that really first tackled something very serious, the Holocaust, using animal avatars in comic form. And that was in 1991. This is Will Eisner, who his family foundation is funding the graphic medicine collection and this lecture. Back in 1985, he said, Unless comics address subjects of greater moment, how can they hope for serious intellectual review? And so this was 85. I think, Mouse really answered this call. And then what we see happening since then in memoir comics is this really happening, that this in the last, 20 years is really happening. So this is Mom's Cancer, as I mentioned. Brian Feast, the author, said, comics were the right medium for the story I wanted to tell. They allowed words and pictures to convey an idea with more economy and grace than either could alone. And so you can see, these are some images from Mom's Cancer. This is when Mom first experiences a symptom of her, what turns out to be her cancer. This is Mom going through the diagnostic phase. This is Mom with starting to drown from Brian's perspective in the language of treatment. And then this is Mom after treatment. And this book just does a beautiful job of using the medium very powerfully. And we'll look at it again in a moment. So this is in 2010, I believe. The British Medical Journal actually published the first article about comics and medicine. And it's by a colleague of mine at Penn State named Michael Green and his colleague Kimberly Myers. And they got the cover, which was pretty amazing. That's an image from Mom's Cancer. And in it, they coined just one more term I'm going to throw out to you, graphic pathography, which are illness narratives in graphic form. So that's sort of the broad term used for these. And we certainly, there's a whole field in the medical humanities called literature and medicine. And one of the things they focus on is the critical role of story in healthcare. Story is incredibly important. If you think about, if you're at the grocery store and you run into your neighbor and your neighbor's arm is in a cast, you don't just say, oh, your arm's in a cast and keep on with the conversation. You want to hear the story, right? When something happens to you, you want to tell the story. And there's all this interesting theory about why you feel compelled to tell the story of what's happening to you with your illness. Because you need to, your illness has interrupted your life, and you need to reconstruct your narrative so that you can sort of see how the future is going to be shaped. And there's all this great, interesting work on the use of story in medicine. So that makes sense that some people would bring their story to the graphic form. And I also want to stress that I'm going to show you a lot of examples. But I want to stress that most of them, and most of the ones you have on the table out there, are nonfiction memoir. So they're created by people who are living with illness and caregiving. And that's critical because this is the first moment in history where the images of what's happening are being created by the people who are living with it, right? Graphic medicine really believes in an edict of the disability rights movement, which is that those best positioned to represent illness and caregiving are those living with it. And that's in Latin, nothing about us without us. And that's important. I mean, ethics of representation are really important in graphic medicine as I practice it. So when I talk about using comics in medicine, I'm talking about two very distinct things, but obviously complementary. Reading comics. So comics are used for patient education and for caregiver education, and making comics. Patient reflection and caregiver reflection. So I'm confounding a lot, but I'm talking about people reading them and making them. So I'm going to go through 4 answers to this question. Why comics and medicine? Why do they work well together? To me, the most important piece is that they help create understanding about the lived, contextualized experience of illness, this what it's like piece. So we're going to look at some examples from these books. First up is a book called Monsters by Ken Dahl, which is a pseudonym for someone named Gabby Schultz. So the book is about this person being diagnosed with herpes, and he's struggling with kind of what this means for his life. And as you can see, the virions are sort of creeping down from below. And he shows this sense of what it's like to feel like contagion for him. And as this book goes on, he actually goes into the science of herpes, and he goes into sort of debunking the idea that this, and he starts having conversations with these variants, but he uses them as a very powerful visual metaphor in this book. Another book that's on a table out there is called Tangles by Sarah Levitt. And she communicates to us the what it's like of this experience. So her mom has early onset Alzheimer's. At this point in the narrative, they thought their mom was well enough to be doing her own bath. So she's approaching, this is Sarah there, Mom, can I come in? Of course. Hi, Mom. Hello, sweetie. Having a nice bath? Oh, yes. Mom's clothes were piled on the floor. There was dried shit in her underwear. The bath water was full of small, disintegrating bits of it. She was dipping her washcloth in the water and rubbing it over her skin. She had no sense of smell, true. what she could see. She just couldn't recognize. She couldn't recognize. There are moments when you have a choice. Fall apart or take a deep breath and just do what needs to be done. Drain the tub, spray the water hard so everything goes down, rinse, wash, rinse, take her hand, let her dry herself, help her with her nightie, tuck her into a warm, dry bed, turn out the light, stand in the hallway outside her door, feel a new loneliness and a new strength. One of the reasons I love this passage in terms of this, what it's like, is that I feel like as a nurse or as a physician, that's not a story you're necessarily going to hear in a clinic visit. But this is, if I have medical students reading this, they have to start thinking about what their patients are living through in a much deeper way. This is a book called Marbles, Mania, Depression, Michelangelo, and Me by Ellen Forney. It's about bipolar disorder. And Ellen uses the medium to show what it's like to have a manic episode. The medium allows her this sort of frantic energy. Contrast that with the medium allowing her to show us what a depressive episode is like. This is a book called Lighter Than My Shadow by Katie Green. It's about having an eating disorder and experiencing physical abuse during your recovery. It's about the thickness of a ream of paper. It's a really big book. It's just beautiful. So these are the kinds of images that we're accustomed to see associated with eating disorders, right? These medicalized, depersonalized, completely removed, not just removed from a meaningful life, the head is literally removed, right? This is the kind of medical imagery that we see as healthcare providers associated with eating disorder. This is the image that Katie Green, the person living with this, gives us. The power of the medium here is to communicate what it's like. More images from Katie's book. And to help us to improve care by contextualizing illness and integrating a sense of body and life. So putting that head back on that body, putting the patient in the driving position of representing what this means to them. And again, I can't stress enough, what's really exciting is this is the first time in history this has happened, right? Katie has said of making this book, comics has been the perfect medium for capturing discomfort that is very real but isn't visible to others. It's a part of a very emotional process of accepting what my body has been through in the pursuit of imagined perfection and in survival and recovery from abuse. So this kind of goes on the point I just made, that in graphic pathographies, the artists create their own iconography of illness. And in doing so, they're creating new knowledge, combining subjective feelings and visual and perceptions with the objective visible representations. Second answer, or maybe the third? Second answer to why comics in medicine. Because the medium itself has unique powers. And you saw that in my example of how I got into this. We're going to look at some examples of this. So this is from Cancer Vixen. This book is out there. This is a wonderful visual. This is sort of what it's like the day you're diagnosed with cancer and yet you want to go out to dinner. And the medium itself gives us this really powerful way to show sort of the way that the word is replicating around you, almost like the cells themselves. This is a 2x2 panel in the book that a colleague of mine who's a bioethicist used as in discussion with medical students about informed consent. And this is sort of reminiscent of the Far Side panel that some of us may have seen, where the dog, like what your dog hears and all he hears is his name, right? Like that when giving a diagnosis, powerful diagnosis, there really aren't, it's very difficult to absorb information, right? And then the other thing I love is this patient empowerment piece here that, by the way, you can bring a tape recorder, record these conversations so that you can then go back when you're calmer and listen to them again and again. This is also from Marbles. This is a wonderful use of the medium to show the states of a bipolar disorder. You can see the mania all the way to depression and sort of as you go in between. This is a wonderful series of 3 books that this summer will be published as one book called You'll Never Know by Carol Tyler. Carol Tyler is a woman who's been making comics for a very long time. And this book series is about her father and his PTSD from World War II and then how it impacted her family growing up. Also, of course, her parents are older now, and so then her father's cancer and her mother's stroke become part of the narrative. It's an absolutely beautiful book. And this is a way that she uses the medium to show us her mother being impacted by her stroke as she tries to draw. She wants her mom to draw for her, and she can show us here how her sort of part of her brain is affected by her stroke and how it manifests and so on. Another example from Mom's Cancer. Again, Brian has a very strong critique of the medical system here, and he says it uses this panel to show us that everything from here up belonged to one medical team at one facility, and everything from the next low belonged to a different facility. And of course, using this metaphor of pain. This is an interesting. This is the first one I think I've shown you that's nonfiction. That's fiction, but it's extremely well researched. I don't know if anyone's familiar. There are 3 books in this series of Doonesbury about war-related trauma. And this one is about traumatic brain injury. And the medium, interestingly, allows to show aphasia. Because you can tell that his thinking is intact. We have thought bubbles, right? But then his speech is not intact. So it's very interesting to, the medium actually provides the ability to do that. And that's really wonderful, too, when you're drawing like doctor and patient encounters, because you can show the complete disconnect or the connect between the thought bubbles and the speech bubbles. So another really wonderful thing the medium allows us to do, and I use this with my medical students a lot, is toggling perspective. So this is what the doctor sees, right? And this is what the patient sees. And it's just sort of like, in the same way a film can be done from you choose a perspective that you're going to choose from. So here's another example from Mom's Cancer. That's what the doctor sees, and that's what the patient sees. And Brian uses it for strong effect to show the inappropriateness of this doctor's behavior. Okay, number 3, answer to why comics in medicine. So as healthcare providers, we see ourselves reflected in these texts. We show up as characters, and reading these books can help us reflect on our practice and perhaps better shaping our care decisions to fit the needs of our patients. I'm going to show you 2 examples, a couple of examples here. This one's from Mom's Cancer again, and this is a longer passage we're going to read together. It's called Usual Unusual. At every visit, the docs always say, call immediately if you notice anything unusual. This simple order turns out to be surprisingly hard to follow. This is Mom, the patient. I have a headache. Yeah, don't worry about it. Oh, okay. I had a deep cough. What? You should have called at once. Oh. I feel weird stingers in my head. That's normal with brain tumor. Oh, okay. I had a leg cramp. That could be a deadly blood clot. Why didn't you call? Sorry. I can't breathe. So you have lung cancer. What did you expect? Right. She's wrong when she complains, and she's wrong when she doesn't. Either way, she feels stupid. How am I supposed to know? And after a while, she stops trying. What I like about this passage is that clearly I don't think any one of these healthcare providers is realizing the bind that we put our patients into, right? And I think, like I said, this is an interesting form of reflecting on practice to think about, we do this. So also in the vein of reflecting on practice, we've all seen the pain chart, right? So there's a cartoonist called Allie Brosh who has a website called Hyperbole and a Half, and a book called Hyperbole and a Half. And she had taken her boyfriend into the ER and was just mortified by this. First of all, by the fact that this is supposed to represent the worst pain a human being can experience. And also it really bugged her that there were numbers missing. There's stuff going on in between there. So she created an alternative pain scale that has all the numbers. And she actually has, if you go on her website, it's called Hyperbole and a Half, she actually has an explanation for what each of these mean. I'd like to recommend that when you go to her website, you have several hours to spend there because her work is amazing. And she actually, we were just talking about this in the car, has done one of the most profound comics about the experience of living with depression. It's called Depression Part 1 and Depression Part 2, and it's absolutely powerful. And it's in a book that she has called Hyperbole. So third, is this the fourth? We're at fourth. The fourth answer to why comics in medicine is that comics have a long and proud history of showing us what has elsewhere been marginalized. I'm going to show you 2 examples of this. So a book that's out there, Specialized, it's by Joyce Farmer, another woman who's been making comics for a long time, shows us what it's like the first time you have to wash your mother's hair. So images of caregiving, particularly in the home, are not something that we have ever seen before. And comics and medicine are bringing this to the forefront, and I think that's really wonderful. Here's home caregiving by a male caregiver as the primary caregiver. This is a book called Things to Do in a Retirement Home Trailer Park When You're 29 and Unemployed. Rolls right off the tongue, by Nye Wright. And he uses these animal avatars very powerfully. This is another large but wonderful, wonderful book. And he shows us, and he's doing absolutely every bit of caregiving and shows it to us in this book. It's really wonderful. Disability, the experience of living with disability has been marginalized. This is from a book called The Ring of Fire. These were zines that E.T. Rushing was doing about crazy things that happened to her. She is a bilateral amputee. She had problems. She just wanted to sort of put this stuff in comics to find a place, a home for it. It's been a really wonderful experience for her. We don't have a lot of images of natural death that we see. This is an amazing book called Can't We Talk About Something More Pleasant by Rash Chast. It will make you laugh, it will make you cry. But in it, she also includes drawings of her mother dying a natural death. And they're absolutely beautiful drawings that complement the kind of crazy cartoons about how they've driven her nuts. And she really brings the whole experience together in one book. And grief. Grief is another thing that we have a difficult time looking at and certainly creating visual imagery for. This is a project called, the website is called These Frames Are Hiding Places, and it's a book in progress now by Nita Mahato, who's a literature professor at the University of Puget Sound in Washington State. And she's really struggling to find an iconography of grief. And she's using a line, interestingly, a more and more abstract line, and it goes on, it's just absolutely beautiful. Most of her work is gorgeous cutout. So I'm very eager for this project. Okay, so we talked about 4 reasons why it works, and I want to just kind of go behind the curtain and think about some of the reasons why we think it works. How do comics work to help us contemplate the complexities of illness and caregiving? I think that this is part of it. I think the fact that comics are a safe place we knew from childhood is a part of why comics work. That even when they cover very serious topics, there's something about the medium and the color and the relationship we have with comics that makes us feel safe. I think this is part of it. That's not a walnut, that's your brain. And this is your brain on text, and this is your brain on comics, right? So you've got this disparate neurons connecting. You've got and as much as this seems ridiculous, there's still a truth in this. I'm still waiting for someone who can definitively, disprove this. But I think it's important about kind of making connections and really having a lot of your brain at the service of what you're doing. I think there's something to this grid. I mean, I showed you my example of how this worked for me. But I'm someone who's really easily overwhelmed, especially by a page of solid text. And so this is a way in which I can just look at one square of the problem. I don't have to think about the rest of it. It's just sort of a stepwise process that I know, when we were kids and we learned how to write in English class, they were telling you to make an outline, and that never worked for me. But making a comment would have worked for me, right? Because then I can think, this is how I think. And I think, I had a professor in graduate school who said that, graduate school is basically a waffle iron on life, right? Like, just take life, it's constantly changing, moving, and close a waffle iron on it, and make these artificial categories and just look at everything piece by piece. And that basically is this, right? I think there's so this is a book by Ivan Brunetti, who's a cartoonist from Chicago, and he says that the deepest realizations come to us from the daily practice of drawing. It's the pencil that teaches best, and I believe this passionately. There's something about the actual drawing. And this is a doctor in the UK named Muna Al-Jawad. She's a gerontologist, and she is working on a PhD dissertation in comic form about what medicine has done to her. And so, of course, as part of this, she has to address the idea of what comics do. So she is showing us here that for her, comics bridge practice, where she works on the wards, and theory, how she thinks about practice. And comics are a place where she can actually bring them together. There's another great image here. She says that comics help her get under the surface of what goes on in the wards, right? And she can sort of like, play with this as a medium and show us that. So perhaps you're sitting out there and you're thinking, that's all fine and good for you, but I can't draw. And of course, what I'll say back to that is, I really, as part of this process, and I kept, doing this, and I kept thinking, why don't we all draw? Like, why don't we use images as much as we use text in processing our experiences in life and processing kind of theories we have and what we're working for? If you go into a school and you go into the first grade classroom and you say to the classroom, who here is an artist? Right? This is what you're going to see, right? And the teacher's all happy and like all the kids like, yeah, you're an artist. But if you go down the hallway into a fifth grade classroom and you ask them the same question, this is what you're going to see. So you get the kid who's like, yeah, I'm an artist, and then the kid next to him's like, no, you're not. And then you get the kids pointing at like Billy. Billy can draw. Even sometimes a teacher joins in, right? Like, go ahead, Billy, he can draw. Because somewhere along the line between that first and fifth grade, photorealism became like, you can draw. And then everyone else is encouraged to stop. And then you've got the kid who, he's like, well, I really wish I was the kid who could draw. Probably can, right? So there's a known phenomenon in education called the fourth grade slump, right? And it was originally, the term was coined for literacy, but it also, research later bore out that it applied to creative thinking. And Jonah Lehrer, in his book, the title is now escaping me. It was the book that was disgraced because he made up a quote about Bob Dylan. Does anyone remember that? And it's unfortunate. Where ideas come from, something like that. Anyway, he made this connection. He talked about there's a part of your brain that comes online right around that fourth grade period. And it has to do with judgments. And so we start judging ourselves and our colleagues, and we start wondering what other people think of us. And this is when we stop drawing. And coincidentally, at the same time, we have been given words, right? So we can write words now. We stop and are often encouraged to stop making pictures to process our thoughts and feelings. And as I said, that happens around the fourth grade. So this is Linda Berry. I mentioned her earlier. She was a huge influence on my work. She said, if a 40-year-old won't draw, if a 4-year-old won't draw, we worry. But if a 40-year-old won't draw, we think that's normal. Why is this? I think we all can draw to some degree. We all have a native visual language. We just stop practicing. Imagine, we'll get to Sarah's quote in a second, but imagine what your handwriting would look like if you stopped writing letters and words in the fourth grade, right? That's basically what you would do to pick up a pen and start thinking up your native visual language if you haven't been using it. And that's what I encourage people to do. Sarah Levin, who created Tangle, said, when people say they can't draw, what they mean is they cannot reproduce something realistically. I would say that a good drawing is one that conveys what you're trying to communicate and people understand it. And as an example, I show you this book, Cancer Made Me a Shallower Person by Miriam Engelberg. All of the drawings are about that drawing level, and it's an amazingly powerful graphic novel about her experiences with cancer. So here's how I see it. This is drawing, this treasure chest. It has a lot to offer all of us, and this is the I Can't Draw Gorilla. And if we can get this I Can't Draw Gorilla off the just throw a banana. He seems very friendly. And we really have access to all of this, we have this language that we're not using. And so that's my little spiel about the fact that I think all of us should be drawing. And I take that spirit into my seminar with my first and second year medical students at Northwestern. In this class called Drawing Medicine, we create reflective drawings about the practice and the changes that they're going through in medical school, and they're thinking about themselves as doctors. We read in the kinds of graphic novels like are out on the table there, and we talk about them. And the students actually then create comments about their experiences on medical things. So I wanted to share with you an exercise I have my students do. So I ask them, I'm very careful with what I say. I say, draw the clinical encounter. And I don't really say much more than that, because I want them to take it where they need it to go. And this is an example of a drawing that a student did. And it's very important to me that, again, self-representation, when the students get up and they show their work on a screen about this big so we all can talk about it together. And what this student said was, what's really hard for me as a new doctor is that I don't know any more than the patient about what's going on. And when we talked about it, we said, well, isn't that really a wonderful thing? That you're starting in a place of parity, right? And I thought it was really interesting that visually, he actually drew their heads at the same level, even though realistically, that's, you know, his legs go all the way down here, his head wouldn't be at the same level. But patient, and I think that was a wonderful thing. The theme of the door comes up a lot. These are first and second year medical students, so everything is really scary for them. And the student who drew this said that this is the hardest part, it's just opening the door to the exam room. Similarly, the hallway leading to the exam room is a very scary thing. And the student said, you know, when I get there, you can see there's color and it's going to be okay, but getting into that clinical encounter is really hard. The student who created this drawing said, the elephant in the room is that both the patient and I know that I have no idea what I'm doing. And the student who created this drawing focused on two things. One, the body language, that as a healthcare provider, that tried to lean in and be a part of the experience, and also the anxiety in this posture here. But more interesting, as interesting, was that he said that the seats they're sitting on, which are the kinds of seats we have in clinics, said, well, interestingly, the doctor is on wheels. The doctor can get out of that situation, right? This person is in their situation. That's a permanent state for them, right? This is one of my favorites. This is a student said that he was going to hang this on the wall in his office so that he always remembered that as a first-year medical student, this is where he started. So this is him with the big heart and the big arm, and he wanted to make it clear that he and the patient were going to face this together. I love the like Picasso-esque head. That's really wonderful. I just imagine he's looking up to the body of medical knowledge that's up in the sky. But that they're facing this together, and that that he wanted to be. That was what he wanted to move forward. Now you can look at this and you see extremely basic visual language, right? And yet the conversations we have around these drawings are really instructive and bring to the fore, as I said, the kinds of things we don't talk about in medicine. The fact that you feel inadequate. And as we go on with these drawing exercises with the medical students, it's really, really powerful. And you can see that the other thing I do is that we actually use crayons. We start with crayons because crayons are awesome. Nobody feels threatened by crayons. Right? So just getting towards wrapping up here. So this is a wonderful project called Alzheimer's, and it's illustrated text, kind of graphic novel about a woman's Alzheimer's, a woman named Alice, her Alzheimer's, and her daughter Dana, who created this book, is a cultural anthropologist, and she literally collaged pages from Alice in Wonderland to make her mom's room there. In the introduction to her book, she said, around the world, comic artists, caretakers, parents, and associated onlookers are taking up their drawing tools, pens, paper, scissors, and computers to depict illness and ways of being human that have been stigmatized. This is graphic medicine. And this is James Sturm. He founded the Center for Cartoon Studies, which is a place in White River Junction, Vermont, where you can go to get a master's degree in comics. And he just put out the Applied Cartooning Manifesto. And he's encouraging cartoonists to not just stay in their basements and lead lives of on this whirlwind of making comics that no one buys, to get engaged in the world. And he actually calls out graphic medicine as a field that is really engaging comics artists. And he said, comics are a blowtorch, and so far we've only lit a few cigarettes with them. And I really think that's true. They're a very powerful tool. One of the ways that he's been using comics very powerfully is with veterans who are experiencing PTSD. It's been, and I've heard of a couple of really wonderful therapeutic projects. And that book, the Doonesbury book that I mentioned, talks in it about how with PTSD, what you need to do is take these flashes of images and reconstruct them into a story. And if you think about it, comics are a really powerful tool for doing exactly that. This is a shameless plug from a book that I've been involved with that comes out in the spring called the Graphic Medicine Manifesto. And these are my colleagues that I work with. One of them is a chicken. I had each of my colleagues create their own avatar because this is Ian Williams who founded the website there at the bottom, and he and I did the first 20 pages of this academic text in comic form, so I'm pretty excited about that. And this is a graphic novel that I'm currently working on. This is actually just a mock-up cover, and it's going to be sort of a graphic exploration of caregiving about the AIDS crisis and my memoir of that, working as a nurse during that time, and then incorporating oral history about the AIDS unit that I worked on. So thank you to everyone for this wonderful opportunity to speak. And I just want to highlight this quote from Mark Spiegelman in Creative Moms that said that librarians are the best friends that comics have. So thank you all very, very much. I appreciate it. So we have time for questions, yes? Does anyone have any questions? Yeah.
What's the connection to Penn State University Press?
Yeah, so Michael Green had met Ian Williams, who did the graphic medicine site. Michael Green is a professor of medicine at Penn State, and he had had this idea that maybe you could teach medical students using these texts. And so he contacted Ian. They organized the first conference in London, the international. So we have conferences every year, comics and medicine. And the first one was in London in 2010, I think. And there's also a scholar there named Susan Squire, who's the chicken. And she does a lot of stuff about STEM research, and she's used comics in that scholarship. She's a literature professor and women's studies professor. So the two of them are there, and they convinced the press at Penn State to then pick up this series, and so they've become sort of the academic hub of the graphic medicine press, at least.
So that's cool. Like, so even if things are coming out in England first, perhaps that can be a way.
Right, and they're actually they're going to publish Bad Doctor, Ian Williams' graphic novel through Penn State Press, which is really cool too because it's the first time I shouldn't say it's the first time an academic press is doing the comic. It's certainly the first time this academic press is having the guts to take on publishing comics. So that's really exciting and feels a little groundbreaking.
I love it because historically academic presses have been serving these underserved things that need to be talked about.
Right.
So.
Right.
So
Yeah.
So first, I'm under obligation to let you know that there are refreshments afterwards, so please stick around and enjoy our company of this little wisdom community here. But I'm really impressed, MK, about how integrated you've brought this into the medical education space. And I'm kind of curious for all of the medical professionals, healthcare professionals that didn't have the benefit of having a U at their school, what might be some easy methods to bring this in to the experience today?
So doctors who are not out of school.
Right. So folks here at St. Joe's, for example, how could we make this real?
Yeah, I think the hook might be, and that's why I designed the website the way I did, not that I did the code work, but I really wanted it to be searchable by diagnostic area. So I think that's the key, is so getting people to realize that in their most important interest area, which is their practice, this has already been going on, right? So
Sure.
I'm a rheumatologist, and I can find, that there's graphic novels about that experience. And so there's probably other answers to that question, but that's the one I think has the most foothold. Like, oh, this is a thing already in my field. And then you've got them, and then you can talk about the ways integrated into education, and then talk that doctor into making a comic himself.
Yeah. Any administrators in there?
A hospital administrator?
Yeah.
That's a good question. You may have to be you may have to work that field. I will be drawing comics of hospital administrators because I interviewed too for the oral history of the hospital that I'm doing there.
Oh, awesome.
Yeah, and I'm going to
Cool.
definitely include that perspective because I think it's one that's, again, underrepresented, and I definitely want to include that, but yeah.
Cool. Thank you.
Yeah.
I was curious, I guess when I first was introduced to this field, I thought a lot about someone coming in and picking up a book in the library who may be dealing with cancer or dealing with one of the issues that this book has come to, and I was imagining this idea of a medical professional actually recommending a comic book to a patient, but I kind of have a hard time imagining that actually happening. So I was wondering if you have some examples, or as a librarian, when it's hard to, especially because if if it's something like addiction or depression, you don't necessarily think of yourself as a patient.
Yeah.
Of how to kind of get it out into the public and into people who maybe are dealing with these issues.
Yeah, it's an excellent point. It's definitely something to think about because some of these texts are not necessarily appropriate for a healthcare provider to recommend to, you know, some of them have like, because in narratology, when it comes to our health, the most critical piece is, what's the outcome? Does the person live, right? Right? You can give someone a book where they're fighting cancer and it turned out to be a horrible story, and like, I don't know. So, and not just that, like there's a book like Epileptic. I would not necessarily give that to someone whose child was just diagnosed with a seizure disorder, because it's a dark, it's this man's story of his brother, and he sees it in a very dark way, and it's so I think there's definitely comics that are made with the intention of patient education, right? Like the Medikids series, there's this whole series. I'm not convinced that's as good as it can get, because they're made up stories, and I think they talk down to kids. But that's just my personal feeling about the Medikids series. But what's really powerful is in this moment, we now can have someone come and say, I'd like to do a patient education comic for kids about what it's like to have asthma. And we can pair a kid with asthma with the comic artist who maybe also had asthma. So to me, the critical piece is understanding the lived experience of this illness and incorporating that into the product that we're using to educate. So a lot of these graphic novels are really great for use with patients. I think they just have to be screened carefully, and you know. So, but to get into your question, I think there definitely are ones out there that are great for recommending. Cancer Vixen is one that comes up a lot. I had a friend who was diagnosed with cancer, who also happened to be a literature scholar, and I gave her Cancer Vixen, and I said, you know, tell me, there's a graph in there that I think I had here, and I pulled it out, where she talks about the energy cycle during her days of chemo, like how much energy she felt. And my friend came back and said, this was really helpful, because when I was scheduling like faculty meetings, I knew not to schedule them right at the depth of after my 2 weeks after my chemo, when I was going to be feeling terrible. I put it before, you know. And so there are, and the Marbles book with bipolar disorder, that one people have reported really helpful, because she talks about individual medications, she talks about how they affected her. And so again, I think it's something that absolutely is part of the future in terms of new books that are created with the patient experience as a critical piece of it. And then also screening some of the ones that are out there, and like you said, let people who are doing nephrology know that there's actually an online comic about what it's like to donate a kidney. You know, like just getting people like, oh, that's a resource I could be using, you know, and we'd like our site to be that resource for people, like I said, come and do that. But it's out there, it's starting to happen, so. I don't know if I answered your question. Any other questions? Yeah.
You mentioned that you got into comics really as a way to build some resiliency, to help with some burnout, and that is nursing. A really hard thing. Have you any advice or any particular works to help other nurses gain that same experience?
Yeah, I agree. Because yeah, we didn't talk about this in nursing school, right? Like we don't talk about it. And I think the best thing I can say is just, you know, the comics are the most democratic art form. You need a piece of paper and you need a pen. You know, and just, you will be absolutely amazed what happens when you just make a box. Draw a few words, or write a few words and draw a few pictures, and then go where it takes you. So I guess what I'm saying is, just start doing it. And that sounds crazy, but you know, get a sketchbook where maybe every couple of days you just do a 4-panel. That's what I started doing. I'm caregiving my 90-year-old mother and 93-year-old aunt. And they make me crazy, they make me laugh, they make me cry, and during this process, I have a square sketchbook, and I just make a cross, and I just do a 4-panel about whatever happened the day before, and it is incredibly helpful. I call it letting go by holding on, because I can get it out of my head. It's on paper now, but I know that I'll have it in the future when they're gone, and I want to think about all that this did to me and changed me in that process, and remember them. And so for me, that's really helpful, because you know, I did this whole comic, and I did this whole theory called narrative constipation. That as caregivers, we stuff it down, we stuff it down, we stuff it down, and like, you're gonna get impacted, right? And so comics are a great emetic, and comics are a great way of like disimpacting, because we got to get these stories out. You know, we can only tell our spouses so much, and then they're like, I don't want to hear anymore. You know, usually when it involves body fluids, right? So we have to find a way, and this is something that worked for me. Maybe, there's other art forms, but I think that the arts can be integrated into healthcare to start to do these kinds of things, yeah.
First of all, beautiful presentation. I really enjoyed this so much. But has graphic medicine ever been applied to sports psychology that you're aware of?
That's a good question.
And the reason I ask, I don't want to interrupt, but I was a athlete in college and developed this. There's no real name for it, but like a mental block
Uh-huh,
where I couldn't throw a baseball 10 feet.
uh-huh.
And doing some, very crude research on my own, apparently there have been other players, major league players that have developed this block. And I actually saw a sports psychologist who had never seen it in baseball, but golfers struggle with it.
Uh-huh.
And listening to it, I'm almost having this epiphany, like, gosh, think about what a therapeutic approach to draw. Because
Yeah.
as a young man, at the time I was 18, 19 years old, and emotionally just couldn't deal with it.
Yeah.
So there was that just where I'd wake up, just I couldn't sleep. And now I look back and how silly that is, because it's just a game. But at the time,
It was important.
and as an athlete,
Yeah.
you live that, and there's no real release for that. So I can only imagine how powerful and therapeutic something like graphic medicine would be, not only for an athlete, but for maybe a sports psychologist or somebody. that-
Yeah, yeah. See, there's a whole other application that we haven't considered. That's
Yeah.
just amazing. Yeah. That makes a lot of sense.
Yeah.
Anybody else have any questions? Well, thank you all for coming.